Salve a tutti, benvenuti su una nuova intervista per la Notte Stellata. Quest'oggi siamo con Ken Critfield della Yeshiva University. Hi Ken.
Hi, thanks for
È
having me.
un, è un piacere ritrovare Ken dopo alcuni anni. Ci eravamo conosciuti a Harrisonburg, alla James Madison University. Ho già avuto il piacere di intervistarlo e oggi siamo qui perché Ken ha da poco pubblicato un libro appunto sulla SASB, ma la novità principale di questo libro è che è un manuale pratico. Quindi andremo a fare alcune domande per conoscere quali sono state, come dire, le necessità di scrittura di Ken perché ha sentito il bisogno di scrivere questo libro e poi quali saranno appunto le motivazioni e su cosa sta lavorando per il futuro della SASB e della TRI. Ok Ken, quindi qual è stata per te la necessità? Cosa ti ha motivato a scrivere questo manuale? Nel manuale appunto si dice che l'obiettivo è per aiutare gli psicologi o comunque chi è alle prime armi ad avvicinarsi alla SASB e a utilizzarlo come uno strumento efficace.
Well, it's the story of this book goes back a very long way. I think we started the idea for this about 20 years ago when I first returned to Utah to work with Lorna as a postdoctoral fellow. And I- she trusted me so much. It surprised me when she said, "There's an idea for a book. We want something about SASB for clinicians, and will you write this book?" And I said, "Of course," and then was also terrified to have this responsibility. Now, in practice, what happened is Lorna and I worked together on the materials for this book across that 20 years, and I think my own development as a clinician and as an educator was advancing, and my ability to write and communicate was advancing. And we had many shared cases that we were supervising in the clinic. And a lot of the stories of the clinic uh, and stories and lessons from teaching graduate students how to use IRT and how to use SASB informed the book. And so it started out probably 20 years ago, it was a much more academic kind of concept than it evolved into. And over time, I think what we saw is the need for clinicians to have a language that allowed more precision of observation about interpersonal patterns and intrapsychic patterns. So SASB tracks the relationship with the self and with others in parallel frameworks. And the the need on the one hand is to honor and articulate the way clinicians have their own intuitive sensing of patterns. I think many clinicians, if they have the ears for interpersonal process, already kind of tune in to, tell me more about how that relationship worked, or give me an example of the thing you just described, or tell me about the history that you just mentioned that informs how you see the world. But what SASB does is it provides more scaffolding and a shared language to allow clinicians to be more precise with their perceptions, but also be able to articulate it across many different audiences. And so the need for clinical awareness, as well as the idea of a shared language system, uh, is a big piece of what informs the book. And the additional benefit of having SASB as a language in the research literature allows all of this to be evidence-based or evidence-informed. So these are the things we had in mind in the 20 years of developing the book.
It's been a long journey for this book.
Yes, and a rich one.
Bene, ci hai spiegato le motivazioni che ti hanno portato a scrivere questo libro. Chi conosce già un po' di più la SASB sa che la teoria che c'è dietro è molto complessa e molto spesso ci si scontra a volte un po' con questa complessità. In che modo hai un po' semplificato, hai trovato il modo di spiegare questa complessità per far sì che questa teoria, questa tecnica, insomma, possa essere utilizzata quotidianamente nella pratica clinica?
Well, that's it. A very good question. I struggle with the idea. I agree that SASB is sophisticated, nuanced, even complex. At the same time, I hold it in a way where I think it can be very simple. And so the book tries to make it simple in terms of understanding its structure, and then to apply the simple structure to the complicated things that people do in their lives. And I think of this very much like SASB is a Cartesian coordinate system. It's got three dimensions, and instead of length, height, and width of a three-dimensional space, it's the three dimensions of focus, affiliation, and interdependence. And the idea is that relationship space is no more complex than walking around your room. But you can do very many complicated things inside of your room. You can place complicated objects in them. You can dance around in funny ways over time. Relationship processes are like this, where humans are complicated and nuanced and sophisticated. The model is just three ideas brought together. And so I think that we do a good job of using the first, I think, three chapters to bring together the concepts. The second chapter is particularly focused on unpacking what is focus. So where is the focus of a behavior, whether it's on other or the self, or directed introjectively inwardly. The second dimension is just affiliation, how friendly versus hostile is the interaction or the particular behavior. And then third dimension is about interdependence, like how connected together in reciprocal action are we versus how separate and independent are we. And it's those just three distinctions that come together to describe any moment of a relationship process. And then the rest of the book starts off, I think, with simple examples and focused examples, and then eventually expands out to talking about clinical case formulation, a set of questionnaire methods that can also support case formulation in SASB terms, and then also how therapeutic interaction goes at the process level, but also across sessions. So we take the simple idea and then provide examples to iterate it across many clinically applied um, contexts. So what looks distant and uh, complicated in the research, we make it accessible for clinicians. But I also don't want to overwhelm clinicians with too great emphasis on reliability and adherence. The reliability in the research world is like of prime importance. But if you're a clinician in training and you want to get your mind around these ideas, the book is an invitation to understand the principles. And then I encourage people to experiment, make mistakes, find ways to calibrate your understanding, including asking patients if you understand them correctly with this model.
Ok, quindi questo, diciamo, libro, questo manuale è un manuale che guarda molto ai nuovi terapisti. Tu sei anche un insegnante oltre che un ricercatore, ho avuto la fortuna, insomma, di venire alla Jane Madison per vedere e toccare con mano la Salisbury e la TRI con te. Quindi ti chiedo, in generale, come vedi l'utilizzo della SASB all'interno dei tuoi corsi con i tuoi studenti? Come la utilizzano e come vedi che sia insomma un po' il futuro della SASB?
In terms of training and in terms of learning SASB, um, I use a few different methods at our program at Yeshiva University. And I find that over time, I am using multiple methods for multiple audiences. If they're new trainees, it's one set of procedures. If they're experienced clinicians, I think I have a different approach. But when people are new to the model and they're working with me, I'm supervising them, the best way to learn is to find materials that are already transcribed or on video. And very much like research coding is you have a structured setting and you apply the codes and you get feedback, or you have a group discussion about what are the underlying dimensions and how do they relate to this presentation or that presentation. So some of the training is very sort of like just traditional structured, and the research and the clinical training don't look very different. But we're experimenting now with some slightly different training methods, which include creating, learning about the SASB model and then creating a profile, not at the level of sentence by sentence, but kind of getting a gestalt of maybe a 5 or 10 minute segment of watching a therapeutic interaction. And then in a larger group, if everyone produces their own like profile of how the patient acted, how the therapist acted, we can have a discussion at the group level and calibrate people's understanding. So one level of training is very micro, and another level of training is a bit more impressionistic. And I find that our PhD research-oriented students need the first one, and then for our clinicians and clinically oriented PsyD students, the way we have these degrees set up in the US, there's a more clinically oriented group, and they tend to I think more broadly and check in with themselves about their session processes more broadly. So I'm trying to use the methods in ways that adapt to the trainees' needs. The third way to bring people into SASB is to use the questionnaires, and they're having an understanding of the model and then having patients rate their own experience of something allows an opportunity for conversation that also deepens understanding of what the patterns are. Oh, wait, I just thought of a fourth way we think of this, which is if I'm supervising a clinician, or now if someone just reads the book, you can bring the SASB most articulated full model, maybe have a laminated piece of paper and bring it into a session or show it on a screen, and have patients map their own experience of a relationship using the language, just intuiting the underlying dimensions. They just can read the words and figure out where their relationships are. If a therapist is needing to help a patient understanding their own patterns, they will also necessarily learn the SASB model through a supervised experience this way. So I'm in a very long way to answer a simple question. Um, I'm finding that different learners respond differently to different ways of learning SASB. And I don't think there's a right or a wrong method. It's just everyone goes through a process. And I think of it very much as learning a new language. And so the primary thing you need is to have access to the language in some form and opportunities for practice. And it's okay to make mistakes. You can, you're not going to break anything by um, deciding something is this code or that code. It's more about, can you detect and allow yourself to detect degrees of friendliness versus hostility, interdependence versus independence, and understand where the focus of a behavior is.
Bene Ken, grazie, ma prima di concludere vorrei insomma un po' introdurmi nel tuo ambito personale, insomma. C'è qualcosa di te che ci vuoi un po' condividere su qualcosa su cui stai lavorando, se ci sono nuovi progetti, nella ricerca, c'è qualcosa che ti sta particolarmente colpendo in questo momento?
Yes. Well, I'm spreading myself too thin with many different projects. I think that the um, some of them are very specific to SASB. Some of them are more broadly linked to interpersonal reconstructive therapy in general. But I think of SASB and IRT as almost synonymous at this point, especially given the way Lorna developed copy process theory. And so the basic ideas, just in a nutshell, is that SASB is a way to look at and track interpersonal patterns, and then the interpersonal patterns that IRT is most interested in have to do with whether or not people's interactions in the present are going to be adaptive or maladaptive. And when they're maladaptive, it's often because there's a copy process, a repetition from a prior relationship, prior learning. So tracking those patterns is one of the most important things with SASB. It's also the way in which Lorna defined personality disorder and how to recognize and work with it. At the core of personality disorder and at the core of copy process is the gift of love hypothesis, the idea that patterns are maintained in the present even when they don't make sense, even when they're maladaptive, through attachment mechanisms, and the idea that the behavior is offered to a loved one, maybe unconsciously, as a way of being reconciled and feeling close to someone. And that's called the gift of love. So, what I'm most excited about right now is there's a recent publication from our work at Utah with the severely personality disordered, complicated cases. And it shows that when clinicians will focus on and talk about the gift of love and help patients um, relinquish and get some distance from that gift of love desire, that their therapies go better. And that what therapists do, their adherence to the model, is kind of a function of people giving up the gift of love. So I think we have, with this article, provided the first evidence that is clear that the gift of love is very important and that Lorna Benjamin's theory um, has validity or probably has validity. So part of the excitement going forward is how to further test and unpack and replicate those findings. To get there, we need to use SASB as measurement tools to understand the degree to which patients actually differentiate from old family in the head and old rules. And that is detectable through how people treat themselves and how people treat others. So SASB comes in there. So the desire right now is to help make research move forward using SASB and IRT ideas, but also to build community of clinicians. So, um, it's lovely to have researchers working for us, but if the clinicians, there's a bridge that needs to be built there. And so I think in many ways, SASB and IRT is ready for community building. And so there is a thing called the IRT Institute, which we now have a website where people can access the questionnaires and materials. And increasingly, we're offering trainings and workshops to clinicians. So this is another piece that I'm excited about that is the future development, is training more people to use SASB and IRT, to become certified and to just have a community that supports this way of working. And then just hot off the press, I learned last week that this was accepted for publication. We have a very SASB heavy article that is looking at Lorna Benjamin's definitions of personality disorder, the interpersonal definitions, and showing validity evidence that her way of operationalizing different personalities in terms of patterns, it works, it holds water. And um, I don't think we can create this kind of revolution, but if I wanted to, this is where I maybe would start, is to say, well, maybe if we don't pay attention so much to psychiatric diagnosis, but we think in terms of interpersonal diagnosis, this would be the framework for doing so, because we offer uh, a way of visualizing prototypic patient patterns using SASB and find that they kind of clump together in different prototypes.
So you are building bridge, working on research,
Yes,
and clinical,
all of the
do
above.
clinical. You
Oh,
are
and
working a lot.
yes, and I need help. If you are watching this response, Andrea, you too, anyone who wants to be part of this club, please feel free to reach out or to be in touch. It's too big of a project for me to hold, and I need lots of help.
Bene, Ken, grazie mille per essere stato qui con noi, ti ringraziamo. Io ho sempre con me il tuo libro, il libro di cui abbiamo già parlato nel precedente articolo, cioè la prefazione, libro che al momento Ken mi diceva che non è tradotto in italiano, quindi non si può trovare in italiano, si trova soltanto in inglese, ma in Italia si trova abbastanza facilmente nelle varie librerie sia fisiche che digitali. So, thank you so much, Ken, to be here with us.
Thank you as well. Thank you for inviting me.